do want to give an update on our cases today. So we've got 6 new cases. These 6 cases are all locally acquired, as in they have travelled from interstate and have turned up positive in their tests. That will put us at 50 active cases, and we've had 12,326 tests in the last 24 hours and 16,838 vaccinations. And we're seeing a lot of people come forward to get their booster shots. That is fantastic. But don't forget, if you haven't had any vaccinations, we still want you coming out and getting that first dose and getting on that pathway to getting fully vaccinated. Now, in relation to these 6 cases, they are in a number of places across Queensland and have been infectious for up to 6 days. So places such as Goondiwindi, Wide Bay, Townsville, Gold Coast and Brisbane South have all reported these cases. In addition, we can report that one of our previously reported overseas positive cases who have arrived from the UK has now been tested positive for Omicron. So that is in hotel quarantine. Now, in relation to 2 of these particular positive cases in the community, we can advise that one person was at the Argyle Hotel in Newcastle, and although in both of these cases we are waiting on the genome sequencing to come back, we are certainly treating them as if they are Omicron. And we know that there has been a large number of cases of patrons who had been at that Argyle Hotel in Newcastle. Secondly, there was the gentleman who flew from Newcastle to Brisbane, then Brisbane to Townsville. This person had attended another exposure site in Newcastle. We are at this stage treating it as if it is Omicron, and it is this gentleman that was on the 2 flights that we put up as exposure sites late yesterday afternoon. Now, in relation to the quarantine requirements for those flights, can I say this, that just as we did with Delta, when a new variant comes along, this is the first domestic flight into Queensland where there is a potential Omicron case on board, that the public health unit acted cautiously to, on the public website, declare anyone on those 2 flights as close contacts, while the public health unit and the chief health officer and our deputy chief health officers analysed overnight what should be our approach when we do have Omicron on these flights. Do we need to take a different approach in quarantine, or can we apply our normal rules, which is those people sitting immediately around in the 2 rows behind and in front, and of course across, being deemed to be close contacts, and the remainder of them being casuals. So there's been a lot of discussions overnight, and I know that there's been contact with other chief health officers and health officials interstate to see how states are dealing with this based on the national guidelines.